These are the videos of the 6-month follow-up of the girl who had Volkmann's ischemic contracture. This was how she had initially presented, and her left hand was affected, as can be seen. We had done surgery on her left hand, and we had posted a video of the surgery. This is at 1.5 months when we took out the plaster, where her wrist and fingers were extended, but she wasn't able to flex at that point in time. Three-month follow-up, she was able to flex her thumb and index finger, but not the other fingers. Also good movement of the wrist that she has achieved. This is now 6 months post-surgery, and you can see the fingers are held in flexion, and you can see there's some movement of the tendons which are coming back. If you ask her to flex the fingers, she cheats a bit where she uses her index finger to flex her long finger. But if you can see that the resting hand position is becoming normal. Taking each finger individually, first we look at the thumb, and she already had some movements of opposition and abduction from before, but now her flexor pollicis longus is coming back, and she's able to flex her thumb also, as can be seen. In the index finger, the movement is pretty good. It's the flexor digitorum profundus tendon which is moving the finger, and the range of motion is pretty good. In the long finger, the FDS tendon is still not working very properly, as you can see. But when you check the flexor digitorum profundus or the FDP tendon, you can see that its movements have returned. In the ring finger also, the FDS movement is just coming back, but the FDP movement is improving quite a lot, as you can see. Similar is the case with the little finger as well.